a comment. And we quickly move on to the next presentation, and then we'll come back to all the presentation for discussion. And next presenter is Professor Sam Ali. And of course, we are now commonly inflicted upon this global crisis of COVID-19. And your presentation would be very important and interesting addition for us, showing us the Egyptian response, the Middle Eastern response to this common crisis. So please, Professor Sam Hari.
I think he is muted.
All right. So sorry for that. Can you see my presentation? It's really a pleasure and honor, and also it's a great responsibility to be here with you, all of you. And I really should extend my thanks to Professor Satoshi and also to Dr. General Said Ghunaim for giving me this opportunity. I'm really excited because the whole emerging field of health security is very novel, but still is a moving target. COVID-19 is a virus that's really teaching us humbleness. This is essentially my analysis. No matter how developed a country is, no one is really ready to understand the full picture, and the consequences of the pandemic will continue for decades. However, it is important to gain as much insights as possible from available data. So the strategy of this presentation is to try to recapitulate the situation in terms of the available data of the pandemic in the Middle East, and also how every or representative governments really acted upon the pandemic and how they responded to the pandemic. It tells us a lot about the importance of the new emerging field of health security. So essentially, let's just go ahead and try to go forward in this presentation. But I usually start with just outlining the content of my presentation. We will start by talking about the timeline and evolution of the pandemic. When did it start and how did it spread? And then we will talk about how the world now is becoming a small village, and it's the small village effect, how the pandemic really quickly spread over to every single spot on this planet. The impact of the pandemic on the MENA region national securities are going to be briefly discussed. And also I'm going to present something about the effect of this on social security and also on individual securities, including job, financial, educational, and food insecurities. I'm hoping that I'm not going to be able to cover every single aspect of these, but we will try to be very brief and succinct to be able to cover all of these. And let us just say that a sense of global Sisyphus, which is a Greek mythology character, where every time he just pushes a huge stone over to the top of a mountain, it falls back down, and he will go back to bring this stone. The world is really in a state of a global Sisyphus, fighting all over with economic crises and also climate changes. And all of a sudden, the COVID pandemic really started to hit. So the Middle East, of course, is one of the most regions in the whole world that really are always passing through turmoil. And the MENA region is going through civil wars, a lot of raging civil wars in Syria, Iraq, Yemen, and Libya. Hundreds of thousands of people are killed every year, and so many of them are forced to leave their homes and flee outside their countries even, and immigrate into camps with living standards that are really less than humane. We have also, between these four conflicts, more than 20 million people have been displaced, and approximately 35 million people are in daily need of humanitarian aid, according to the Pew Research Center. So the region is really in turmoil. And the result is that this region is usually described as an island of misery. And as you can see from all the news coverage of the area, plenty of damage, a lot of internal conflicts and civil wars, so many casualties, and also so many people are displaced out of their homes. Not only that, but also the region is suffering from really existential problems, including the shortage and of water supplies. As you can see from this map, the light blue regions are those with physical water scarcity. So people are really suffering already from lack of water and natural resources. And all of a sudden, meanwhile, the COVID crisis had hit this region, and this affected the lifestyle of everyone. We are not used to sanitizing public areas. We are not used to restricting our movement, even to travel. We are not and also to restrict our movement to go to cafe shops or to sit socially with everyone else. And since the beginning of this crisis, national, social, economic, education, food insecurities has risen. And really, this is a kind of public awareness campaign that was enforced and impacted our lifestyles, every one of us, not only countries in civil wars. To give you an example, for example, the health system in Egypt is already overburdened. So this system is, just to tell you how burdened or overburdened this system is, look at this comparison between the number of hospital beds and the capacity of hospital beds. You can see that on the bottom down there is Iraq, with 1.3 beds per 1,000 people. Egypt is actually 1.5 per 1,000 person. And this was a statistics at 2016. Of course, you cannot compare this with countries like Japan. Japan is really miles ahead of everybody else's in terms of the number of bed capacities in hospitals. To understand how quickly the pandemic really spread over through the Middle East, I just prepared a couple of slides and maybe infographics to show you, for example, the quick implications or quick application of government stringency index. And this stringency index is essentially a measure for how government applied things like school and public place closures, and also how quickly they applied also travel bans, etc. And it is scaled from 0 to 100. And as you can see, the spread of this stringency index, of course, started from China. The hurricane started in China, and you can see also that it's quickly covered everywhere else. The measures are between 80 and 100, and you can see that the Middle East was primarily affected the earliest, and this is of course because the close proximity of the region with Asia and China and so on. So the next thing that we just should really have a look on the timeline and evolution of this pandemic, let's just have a look on the cumulative confirmed COVID-19 cases in several representative countries in the region. You would be able to see or to compare countries like Israel, Saudi Arabia, Egypt, Iraq, Morocco, and Lebanon, and Jordan, and Palestine. And you can see in the beginning, this is during the early summer, spring, or the spring of last year. Egypt was ranked second after Saudi Arabia, but quickly Iraq has been catching up. And then Israel was growing very quickly in terms of the number of reported cases. As you can see, Saudi Arabia was going down, and Israel now, by the end of the year last year, some other countries are gaining momentum and rising quite quickly in terms of the number of reported cases, confirmed cases. Israel now is exceeding everyone else, and Egypt is staying with Palestine down in the bottom of the list. And of course, you may ask whether this is really because of problems associated with lack of testing. So in my next infographics, I'm showing how testing has been considered. But before that, we just will have a look on the number of confirmed deaths in several of these same countries. And you can see in the beginning, Egypt has been reporting a high number of cases, although Egypt was reporting the lowest number of confirmed COVID-19 cases, but the number of deaths in Egypt was really high up to summer of the last year, where Iraq was taking over, and gradually many other stores started to really rise. And as you will see that by the beginning of this year, some countries really was jumping over to take over this trend, and you will see that Jordan and Iraq were really going quickly. Israel is now and Lebanon are surprisingly among two countries that are in the middle range here. But you can see that Egypt is showing a large number of mortality or deaths associated with COVID-19. In fact, this is a little bit misleading because it's a tricky statistics, because in order for you to get some sort of accurate number, you have to normalize by the number of people, by the population of individual countries. And here you will see something that's really interesting in terms of this normalized statistics. You will see that Israel is on the top of this statistics because, of course, the number of people or the populations are low. You will see Egypt is maintaining a low profile in this case, and then Iraq and Saudi Arabia were rising up. In last summer, Egypt was going down, as you can see, and Israel was rising quite quickly in terms of the normalized number of deaths, and continues Israel to be on the top until Jordan. And you will see that also Lebanon and Palestine are going to rise up quite quickly by the beginning of this year, where Lebanon now, there is a crisis of healthcare in Lebanon, and the number of deaths has reached about 700 person per each million people. And look at this surprising number here. Egypt is in the bottom of this list, and this is definitely because the normalization is by the largest population in the region. So let's see now and also take some ideas on the testing policies, because of course the testing policies controls the number of reported cases. And look at this classification here. You will see that countries that are colored in dark red or maroon color, they apply no testing policies. In brown, these are countries that are applying measures to test people with symptoms, and key groups only a selective populations that, for example, VIP people and people that are very, very capable in terms of their finance and power. Again, also in the light blue here, anyone with symptoms are tested, and in the dark blue regions, you will see that open public testing is inclusive, even with asymptomatic people that do not show any symptoms. And you can see that Egypt is surprisingly among countries that applied fairly good amount of testing in this regard. So the impact, let's now move to talk about the impact of the pandemic on the national security of the countries. Definitely, there are plenty of issues associated with countries that were already suffering from civil wars. For example, Syria, for instance, 3 million people are currently living in refugee camps, and reported its first case of COVID-19 on July 9th on 2020 last year. However, a little bit later, when people tested randomly one of the biggest refugee camps, which is the Atama refugee camp, they discovered that at least 40% of people were positively tested for COVID-19. This was really shocking, and it tells you how much the pandemic is spread over in many, many places. In Yemen, of course, a worsening humanitarian crisis has been going on for several years now, and more than 80% of Yemeni's population is dependent on humanitarian assistance for basic needs and services. The country's healthcare system, of course, is similar to many, is even worse to many other countries because of the lengthy conflict and because of the lack of financial resources. So Yemen Yemen's health sector is already overwhelmed by surge in COVID-19 death rates. And a personal experience here is that I have had a postdoctor who were working with me. She is a Yemenis young doctor, and she was working with me in Egypt. But all of a sudden, she heard that all of her families were infected by COVID-19, and she had to flee back, even though the trip back to Yemen was essentially very, very dangerous because she was living in an area that's surrounded by the Houthi group. So in Libya also, there have been escalating conflicts, of course, which impedes COVID-19 responses. Libya's health system is also fragile after years of conflict and is consequently at high risk of being overwhelmed by COVID-19 crisis. These are all factors that are essentially affecting national securities. Up to 1 million people in Libya have been rendered dependent on humanitarian assistance as well. On the other hand, during the pandemic, there have been a resurgence of terrorism. For example, there are reports that ISIS in 1 week, their claimed operations has risen by more than 70% only in 1 week. So this is really a challenging situation. Also, the stabilization efforts in many of the countries that I mentioned are really hampered by the COVID-19 challenges and trying to give care to people in these countries. Let me also move to show you the social impact. Let's see how countries has applied the face covering, because face covering can indicate the social distancing measures, and this is of course a kind of things that have been really reported. According to this infographic, you can see that early on last year, the enforcement of the face covering started in China and in the Middle East, where this is required at all level. Again, this is, I think I moved quickly to the next slide. Let me just go back. Sorry about this. So for face covering, what happened is that essentially it started in China and then spread over to some countries in Europe, as you can see. And then by spring last year, it started to cover most of the global sphere. And as you can see, Egypt was among the earliest places to apply these measures and then to maintain these measures where it is required in public spaces. Later on, these measures became more stringent in this region, including required outside home at all times and required in all public spaces. Let's go for the next measure. Also is the impact on education. Here is the infographics that's showing the spread of school closures in the whole world. And you can see in brown, this is required. As you can see, that is happening all over the globe, in fact, and it is maintained and preserved over these regions. In fact, there are some problems associated with the public education in Egypt because it's, of course, it can be the biggest source of infections, and also there have been some glitches and problems associated with the foreign education in Egypt, like the American school system and the British school system, where a lot of confusion happened because of the pandemic in the original countries of these schools. So there have been a lot of confusion. A lot of students were taking tests from home. Let's also have a look on how government were really providing some aid to their citizens. And here in this scale, the brown color, there is no income support. The light blue is less than 50% of the lost salaries, and more than 50% are expressed in countries in blue. You can see how this evolved over the past 1 year and a half. And you can see in the beginning, nobody offered some assistance. And of course, it started over in Scandinavian countries and of course, North American countries and rich Gulf countries. Surprisingly, Egypt started and many other Arab countries started to provide this subsidies and support to people that lost their jobs. And this continues until today. They are providing less than 50% of the lost salary. But of course, this has been alleviated or left over in most of the African countries and India and many Asian countries and South American countries. But Egypt and Sudan, surprisingly, are still maintaining this government support. So food insecurity, because of course the closure that happened over borders, international borders, many countries in the Middle East were already vulnerable to food insecurity and economic shocks before the events of 2020. Lockdown measures took effect, incomes and employment fell drastically. People were not able to, in many places, were not able to fulfill the needs of their families. Luckily, Egypt didn't suffer from this issue. And in fact, I think if we made some sort of measures over this past year, we will notice a noticeable increase in people's weight because people were staying at home and eating a lot. This is one of the things that probably should be investigated later on. But of course, there have been a really diverse impact of this lack of food in the region. Let me also just give you an idea on the vaccination trends in the region. As you can see, of course, Israel since the beginning are essentially on top, and not only in the region, but also globally. Israel is the top country or the most important country that has already administered vaccination to more than 80% of its population. However, I think also there are some politics that are associated with vaccination. So let me just give you some examples. For example, vaccination is not administered equally in Syria, for instance, because of the conflict and local conflict. There have been a lot of reports reporting that the government in Syria is only administering vaccination to their group, the governing group, while ignoring places where there are some conflicts and insurgencies. Palestinians are not vaccinated, and this is really surprising because Israel, as we mentioned, have already vaccinated more than 80% of its population. And although they were sending vaccinations to settlements, Israeli settlements in the West Bank, there haven't been any vaccination efforts to Palestinians. As I was searching for this information, in Yemen, Houthi religious leaders have told locals not to use vaccines made by Jews and Christians. This is really ridiculous. And at one stage, the Houthi health administrator said, or the health minister said, even that they will develop their own COVID-19 vaccination. This is really ironic and bizarre. So let's just look at what we learn from this kind of information coverage that we have went through. COVID-19 pandemic is the most striking example of a global crisis in modern history. It has transformed the concept of global health security because now countries has to foresee what's going to happen in terms of the spread of pandemic or similar pandemics. The international community need to glean new multilateral approaches towards respective mechanisms and responsive mechanisms to crises similar to the COVID-19 pandemic. COVID-19 pandemic resembles a massive conflict because it disrupts access to food, wages, and medical care. So one should really think of the pandemic as a kind of local conflict that may be transferring into a kind of global conflict. Effects of COVID-19 may endure well beyond the current initial phases of the crisis. We really don't know how long this is going to impact the international economies. And of course, there have been a blessing for several places in several countries because, for example, the medical suppliers and also vaccination countries that really manufacturing vaccinations, this is for them is a huge opportunity. Whereas for poor countries, this is really, really a big crisis. Again, stabilization efforts will be critical to assess with COVID-19 response over the coming months and also to ensure long-term peace and stability in the region. Many countries, including Japan and other countries, would really need to understand that stabilization and trying to handle shortage of medical supplies or their frontline protection against second and third waves of the pandemic. Healthcare and contributions to the well-being of individuals and societies must be recognized because we are living in a small world and every one of us is really affected by what's happening not only in the neighboring country, but also in very, very far countries, as we are now all have witnessed. I'm ending by African proverb, who said, if you want to go fast, go alone, but if you want to go far, go together. And I really thank you for your attention, and I'm be very happy to respond to any question that you may have.
Thank you very much, Sameh, for your very comprehensive assessment of the COVID-19 impact on the region and also in Egypt. I'm asking all to audience, if you have any specific questions to Dr. Sameh's presentation on COVID-19, would you raise your hand, raise your blue hand, electronic hand? And before taking questions, I might be, the first to pose a small question. And I want to know about the situation in Egyptian healthcare system. Even before the COVID-19 crisis, the situation in Egyptian medical and healthcare system is known for the stretch, for the stress. It's been under heavy pressure of overpopulation and scarce resources. Of course, your hospital is exceptionally equipped with, but huge population in Egypt doesn't have enough, access to the advanced and universal healthcare system. So how the situation has been influenced by the COVID-19 arrival of a new and huge global crisis. So from your standpoint, what's the direct impact and of COVID-19 right now, and how do you foresee how Egypt will navigate this difficult, phase?
Well, this is very important question indeed. Let me just say that not only Egypt has suffered a lot, everywhere, even very advanced countries have been faced with a huge challenge to cope with the needs for emergency medicine and taking care of a huge number of people. The problem also is that with a lot of unknowns, so many people rush to hospitals to try to get some cares. And of course, this would occupy many of the already limited number of beds, as I explained. And this really caused huge overburdening of the healthcare system. Egypt definitely has suffered from accelerating increase in the number of populations, and while not coping with these increasing number of populations with parallel healthcare facilities is in fact. So however, I should say that this has been the situation for several decades, and this of course really left the situation quite dire. And even though the current regime and government has been really trying to improve the healthcare system, and there have been huge efforts that are really applauded by the international communities, including the action against virus C, which was a huge pandemic in Egypt with the minimum estimate of the number of people with hepatitis C was about 10 millions, which is really a huge burden for any country. But Egypt has led a campaign to eradicate virus C, and it was quite successful. It was really very good campaign. Again, also Egypt initiated what's so-called 100 million health. It's 100 million صحة in Arabic, 100 million health initiative. And this has been really an exemplary system where now we are the leading country in the whole world in terms of the knowledge about the number of chronic disease patients in the country. So there is now a database where we know exactly who had diabetes, hypertension, and so on. And these are extremely important efforts that has been administered to the society to improve the general public health and to acquire knowledge that are really critical to know how to move forward. And of course, Egypt also has been really aware of the changes that's happening in modern medicine. For example, there is a genome, the first Egyptian reference genome project has been announced very, very recently, probably last week, actually. It got approval from the president, from President Sisi, and this is spending more than 2 billion Egyptian pounds, which is probably closer to about 150 million US dollars. And this is to determine this is the first project to determine the Egyptian reference genome. And this is very, very helpful in terms of the health implications. So, however, on the ground, public health systems are really deficient and they do not have sufficient number of beds. Even the the urgent care and emergency care were really, really limited when the pandemic hit. I would say that my assessment is that the public health officials learned it quite quickly, and they actually improved the infrastructure quickly. And the military in Egypt has established a lot of hospitals, so many hospitals with large number of beds, and this essentially helped to siege and contain the pandemic, in fact, in Egypt. And my assessment is that the performance of the Egyptian government during this crisis has been excellent, in fact. And this is a professional assessment of what really was going on the ground.
Thank you very much. You know, the combination of digital economy and new public health system would be a key for Egypt or any country to overcome this, you know, crisis. And yeah, I think Egyptian case and its response and its relatively mild, you know, condition right now would be a very, you know, very important case for study. So we will check it further on in the near future. So thank you very much for your the information you gave to us. And also some question is coming in to one question from Ibrahim. It's about vaccine passport. So from Egyptian point of view, what kind of, you know, standardization or a passport system for the international movement of people? What's the Egyptian, you know, policy or diplomacy on this issue? You know, there are different possibilities, like international organization like WHO would take lead, or in regionally, for example, some Gulf countries would need the quick renewal or a quick resumption of the movement of people, at least in the region, for, you know, for they are so dependent on this you know, people who work across the borders. So there are many possibilities, but from Egyptian point of view, what kind of system would be, you know, required or needed?
Again, this is an interesting question. Of course, this is a quite new situation that everyone on this planet is suffering from. And definitely we are learning along the way, and everyone is trying to learn and to adapt. However, countries that are not producing their own vaccination are in a bad situation, because you are not on the top of the list. Definitely you're not getting what you really need and what your population need quickly. And this is a situation that Egypt has been suffering from. And definitely here, politics and economy are playing very important role. This is one point. The other point is that the public awareness of the meaning of vaccination and the conspiracy theory that has been spreading over in the whole globe. It's not only in Egypt, it's actually everywhere else. Even in Europe and in the United States, a lot of people have declined to take the vaccine because they believe that they are gonna implant like a microchip in their arm, and they are gonna be able to follow them everywhere and so on. Again, also some other people, they believe that this is they are testing vaccines on our poor people and so on, and this has even been a popular conspiracy theory even among professional people and surprisingly among physicians. Some I would say that maybe 30 to 40% of all physicians has declined to take vaccination because of these fears and these conspiracy theories. Definitely the cybersecurity aspects that Dr. El-Gindi has been talking with us about, and also the media, they should be playing a very important role in this to inform people how they really search for the truth, how they really think rationally about the importance of vaccination, and how to see that without vaccination, we would have been suffering from so many diseases. And of course, to be able to contain this and to be able to alleviate the economical implications of what's happening, you need to siege and you need to contain this pandemic. And there is no way that you'll be able to contain it without vaccination. So this is an opportunity for everyone to work together. And I think it's a perfect cluster here because now we have all aspects in one place. And I think the government has been trying to do this, and they have made a system where every citizen should register using their national security number to take his or her turn in getting the vaccine. And this is now, of course, the efforts has been very slow because, as I'm saying, not so much of the vaccine has been flowing into the country because we are not on the top of the list of the manufacturers. There have been some efforts in Egypt. I'm hearing that there have been some efforts to manufacture a local vaccination, but there haven't been much information about it, and we are on the wait.
Yeah, one of the, of course, long time focal point for industrial policy in Egypt is, it's pharmaceutical industry and pharmaceutical sector. But yeah, unfortunately, we don't hear, much from Egypt about its autonomous, production. If there are some news, I'd like to hear from you, but from anyone. But now we want to open to the floor our discussion. But maybe before that, I'd ask Dr. Said Ghanem. Said, we now discuss about all three topics by three presenters, and actually we already know, the topics are interconnected.